I'm Jonah Comstock, Editor-in-Chief of pharmaphorum. I'm here at Reuters Pharma USA in Philly. I'm joined by Nick Altebrando, Chief Product Officer, and Shireen Saxena, Director of External Affairs at Ada Health. Thank you both so much for joining me.
Thanks for having us.
So Ada Health, I know it's a medical chatbot company, and I probably there's an objection to describing it that way. I know you guys have been in the digital health space for a little while, but tell me a little bit about what you're doing right now and why it brings you to a pharma conference.
So it is chatbot-like. Well, we could talk a little bit about how it's not like other chatbots because that's pretty important. We are so the Ada Health solution, and it really is it's an end-to-end patient journey solution. It starts prior to symptom generation, through through assisting people at kind of refining potential treatments or conditions that they may have, and then it helps them find the right care journey for them following. So I could give you a quick example. If we drive people in through either through our own products or through very specific targeted programs where we find people on the internet who are experiencing symptoms for our customers. We drive them to specific assessments where they're able to answer a series of AI-driven questions, and at the end of the experience, we direct them to the best care for them, whether it's telehealth services that we deliver through a partner, or finding them a specialist in their area, or just giving them the information to go have a appointment with their own provider.
So I want to talk about the tech underpinning that, but maybe Shireen, you could talk a little bit about sort of why you guys are at a conference like this and how you interact with pharma.
Yeah, for sure. So, I mean, as Nick mentioned, right, we are really working across the entire care continuum from beginning to end, right? For people who are experiencing symptoms and don't know what they have and really need to put a name to their symptoms, as well as people who know exactly what they have, like diabetes, but don't know how that actually affects their lives, or in terms of other conditions, or what treatments might be available to them, right? So what we actually do is partner with pharma companies to make sure that people who have a certain condition get the right care at the right time and in the right setting, right? So many of the people that experience sort of, let's say, rare diseases or even the most prevalent conditions end up circulating the system for 3 years, 5 years, even, up to 10, 11 years, right? So what we're looking to do is shorten the time to diagnosis, identify people, match them to the right treatment, and get them sort of started on their care journey. We absolutely need partnerships with pharma companies to be able to do that, because they are the ones who have these incredible treatments available. It's about making that right match.
Interesting. So I was in the digital health space before I was a pharma journalist, and I remember when these sort of triage chatbots, there were lots of them, and the technology was much simpler then. It was more decision trees. And it always seemed like an idea that seemed like a really good idea, but was really difficult to execute in a way that people actually interacted with and benefited from. So what's under the hood? What's kind of some of the secret sauce that makes Ada Health actually work?
And I'm going to contrast this to the LLMs just because they're so popular today, and they're so they're really so interesting in the way they work and the information they deliver. But the way that an LLM uses AI is you ask it a question, it seeks out the most highly probable correct response, and it delivers it. The way that Ada works, and the AI, it's been using AI for 12 years, which I don't even think they exactly always called it AI 12 years ago, but it's the principles that are considered AI today. You start with putting in a key symptom, and it uses AI to identify the best next question, and that repeats. So each time you answer a question, it goes back to the well, uses probabilistic AI to say what's the next question I need to limit this down further. And you go through over the course of a minute or two, and it's able to, at a high degree of clinical specificity, have a list of possible conditions that may apply to your symptoms. And that is just the first step. That's a core technology for us. But the the whole care journey begins before that, and it extends to directing you to the best potential treatments afterwards as well.
Right. And go ahead.
Do you mind if I just quickly add to that? I think it's interesting that you mentioned decision tree because a lot of people ask about that. And ADA is, as Nick said, very much a dynamic model. It's the probabilistic dynamic model that essentially takes your responses about the symptoms that you do have and even the symptoms that you don't have, which are just as important to then generate that next question. You also started off by asking us a little bit about whether ADA is sort of like a little bit like a chatbot. And so many people will say, well, what's the difference between ADA and ChatGPT, for example? But with ChatGPT, right, you yourself as let's say a patient or someone who's not feeling well, have to feed ChatGPT with the information that's top of mind, right? And then ChatGPT might give you sort of a series of information, a lot of which is helpful and a lot of which is probably either not helpful or not relevant to you, right? But what ADA does is actually have a conversation with you about how you're feeling, asking you, like, do you have this? Do you have that? Does it get worse? How long has it been going on for? And then, puts everything together in a medically relevant context for you to then be able to decide, okay, what's next for me? Do I book an appointment? Do I reach out to my PCP? Do I do telehealth? Do I just wait it out at home? Because you can actually see whether this is sort of something you can manage at home or something that is actually an emergency, right? So very much like a sort of unique setup compared to a lot of the other players that are out there.
You talked a little bit about some of the use cases and some of the organizations that you partner with. But tell me more about kind of where is ADA Health right now kind of deployed in the wild and how is it working?
Yeah, for sure. So, maybe just to take a little bit of a step back, right? Like we at ADA really think about how we can make sure we provide the best premium care experience for all people, right? And what we've been talking about lately here, also here at Reuters Pharma, is what does health equity mean in the context of providing a premium care experience? And we've talked about affordability. We've talked about the fact that, for example, we have a telehealth offering for less than most people's copay. We want to make sure that people are able to use our product in their language. So we offer ADA in 11 different languages. But we've also talked about geographic coverage, right? And you asked about where ADA is deployed. We're available in over 190 countries. We have worked with governments in South Africa, for example, to make sure that new and expectant mothers actually can ask questions about themselves, but also their newborn infant who is not able to speak and might be having symptoms, and they may be hours away from the nearest clinic. But also here in the US, where we've got a situation where some people have the best, most premium health insurance, and others who are completely uninsured or underinsured, right, and are using the emergency room as their primary care provider. So we really try to make sure that all people get access to this sort of basic service that can actually be pretty life-changing if it comes to being matched to the right treatment. So over 190 countries to date, and 11 countries available as of now.
And just to add quickly, commercially, it's deployed at some of the biggest health systems in the country as part of their kind of find a doctor feature. I'm looking for a provider, and the system will say, well, what are your symptoms? And it presents you with ADA and uses the engine to help direct you to the best possible treatment. And with pharmaceutical companies, it's much more condition focused. It's the same basic flow, but it's concentrated on around a specific condition instead of symptoms, and also delivers you to the best care at the end.
Are these use cases, is it white labeled or is it, do you know it's ADA Health?
It differs. With our pharmaceutical customers today, it is not white labeled. It is ADA Health. With our health system partners, it depends on their preference.
So how do you measure something that is this complicated in terms of whether it's working? Because there's a question of outcomes. There's also a question of accuracy. And it's hard to say, like, if there's not exactly a standard of care to compare to, because some of these people might not have gotten care at all if they weren't diagnosed properly. So yeah, how do you kind of measure how you're doing and then use that data to let people know that you're actually improving access?
Sure. So data is obviously extremely important to us. I think a couple of things here. So we look at data across a few different areas. One is we look very closely at sort of user behavior, right? When we're talking about access, we know exactly what time of the day our users take our assessments. We know where they're taking the assessments from. We know whether they're completing the entire assessment or if they're dropping off sort of at a certain point. So we've got a lot of information about sort of the funnel in terms of the behavior of our users. We also have a lot of information around sort of the demographics. So who exactly is using our solution? We know that, for example, younger women tend to sort of make a large portion of our mobile database, which means that we are extra honing in and committed to working on women's health conditions as well. And then the third piece is on clinical information. So I think this gets most closely to what you're asking about. One of the most important things that we're working on is, with health systems, for example, is trying to understand what the advice level is for the people that are taking these assessments, right? Is this something that you could actually manage at home, or is this an emergency, or is this something in between? You should probably go see your primary care doctor, right? So the clinical data that we can see are things like emergency level, but also what is the presenting complaint, what are the most common symptoms, and then what are the conditions that are then sort of presented at the end that are most common. So yeah, that's sort of like a sort of overall mix of the data that we've been looking at.
The stakes are high in this situation, right? Because if Ada Health tells someone, this is something that you can care for at home, or this will go away on its own, and it turns out they ought to have seen a doctor, then there's a question of liability and certainly, if nothing else, optics. How do you manage that? How do you err on the side of caution but still make it a useful tool?
Yeah, that's a great question, and something that is very important to us, particularly when we work with our health system clients, right? So we as ADA actually tend to be on the much more conservative side. So we very much understand sort of our role in the overall ecosystem and how important healthcare providers are. So this is not meant to sort of keep people out of seeing their doctor, but more making sure that they actually are at the right level of care. So we're actually more, let's say, conservative or on the sort of safer side, and encourage people to go sort of meet their doctor as well.
Well, I think we're probably close to wrapping up, but I wanted to ask a little bit about the show we're at. Anything you guys have seen or heard that you think is interesting, or some of your kind of key takeaways?
I think the thing that has resonated most with me is just how much focus there is at a pharmaceutical event on the holistic journey of the patient. I've been going to these events for a long time, and it hasn't always been this way, and it's a great thing to see. It's and I think it's really an expression of the change in the industry of how caring for a whole patient's journey is really becoming part of a shared responsibility.
Great insight.
Yeah, I couldn't agree more. I mean, I've seen people who, over the last couple of years, I think there's been a huge shift in the way that pharma puts patients at the center. And you see very strong partnerships between digital health companies and pharma for precisely this reason, right? Like both companies do different things, and now they're sort of meeting in the middle by putting the patient at the center. And you see that in the more recent hires. You see that in the topics that people are talking about here in the panels, and what is getting people excited. So I think that's been a very interesting key takeaway of this conference.
Excellent. Well, thank you both so much for chatting with me, and good luck.
Thank you.
Thank you.